Have you ever wondered if the way you drink water could actually affect your blood sugar? Most seniors know they should drink more water, but very few realize that when, how, and how much they drink can make a surprising difference in diabetes management and overall health. A simple hydration habit could help your kidneys work more efficiently, support healthier blood sugar levels, improve energy, and even reduce the risk of dangerous dehydration. Stay with us, because today's information might completely change the way you drink water every single day. As we grow older, our bodies naturally go through many changes that affect the way we regulate fluids. One of the most important changes is that the sensation of thirst becomes weaker with age. Many seniors simply do not feel thirsty as often as they did when they were younger, even when their bodies need water. This means that dehydration can develop gradually without obvious warning signs. A person may think they are drinking enough because they rarely feel thirsty, but their body may already be operating with less fluid than it needs. This reduced awareness of thirst is one reason healthcare professionals encourage older adults to drink water regularly throughout the day instead of waiting until thirst appears. Water is essential for nearly every function in the body. It helps transport nutrients to cells, regulates body temperature, supports healthy digestion, lubricates joints, and keeps organs functioning efficiently. For seniors, these functions become even more important because aging tissues are often more sensitive to changes in fluid balance. Even mild dehydration can affect how the body performs everyday tasks. A small drop in hydration levels may contribute to fatigue, headaches, dry mouth, muscle weakness, constipation, or dizziness. These symptoms are sometimes mistaken as a normal part of aging, when they may actually be linked to inadequate fluid intake. Hydration also plays an important role in supporting healthy blood sugar management. Blood contains water as one of its major components. When the body becomes dehydrated, the amount of fluid circulating in the bloodstream decreases. This can make the concentration of glucose in the blood appear higher because there is less water available to dilute it. While drinking water is not a treatment for diabetes and does not directly lower blood sugar on its own, staying properly hydrated helps the body maintain normal physiological processes that support overall glucose regulation. The kidneys rely heavily on adequate hydration to perform their job effectively. These organs continuously filter waste products and excess substances from the blood while maintaining the body's fluid and electrolyte balance. When blood sugar rises above certain levels, the kidneys may excrete some excess glucose through urine. This process requires sufficient water to function efficiently. If a person is dehydrated, the kidneys may have a more difficult time maintaining this balance, which can place additional strain on the body. Proper hydration supports normal kidney function, an especially important consideration for older adults who may already experience age-related changes in kidney performance. Many seniors live with chronic health conditions that can increase their risk of dehydration. Diabetes itself can contribute to fluid loss, especially when blood sugar levels remain elevated. Higher glucose levels cause the body to produce more urine as it attempts to remove excess sugar, leading to greater water loss. Certain medications commonly prescribed for older adults, including some blood pressure medicines and diuretics, may also increase urination. Combined with a reduced thirst response, these factors can create a situation where dehydration develops more easily than expected. Another age-related change is the gradual decline in total body water. Compared with younger adults, older individuals naturally have a lower percentage of water in their bodies. This means they have a smaller fluid reserve to draw upon during hot weather, illness, physical activity, or periods of inadequate drinking. As a result, even relatively small losses of fluid can have a greater impact. Hot summer temperatures, fever, vomiting, diarrhea, or prolonged time outdoors can quickly increase hydration needs and make careful attention to fluid intake even more important. Good hydration also supports circulation by helping maintain healthy blood volume. Adequate blood volume allows oxygen and nutrients to be delivered efficiently throughout the body, including to muscles, the brain, and vital organs. When hydration levels drop, circulation may become less efficient, contributing to feelings of weakness, reduced concentration, or lightheadedness. Older adults may be more vulnerable to these effects, particularly when standing up quickly or engaging in physical activity. Maintaining proper hydration can also benefit cognitive function. The brain depends on a stable supply of water and oxygen to perform well. Even mild dehydration has been associated with reduced attention, slower thinking, difficulty concentrating, and temporary confusion in some older adults. Because these symptoms may resemble other medical conditions, recognizing the role of hydration can be an important part of supporting overall well-being and day-to-day functioning. Water is one of the body's most essential nutrients, yet it is often overlooked when discussing blood sugar management. While drinking water is not a cure for diabetes and cannot replace healthy eating, regular exercise, prescribed medications, or insulin therapy, it plays an important supporting role in many of the body's natural processes. For older adults, maintaining proper hydration can help the body function more efficiently and support systems involved in glucose regulation. Every cell in the body depends on water to carry out its normal activities, including those responsible for producing energy and maintaining metabolic balance. One of the most important ways water supports blood sugar health is by helping maintain an appropriate balance of fluids in the bloodstream. Blood is made up largely of water, which allows nutrients, oxygen, hormones, and glucose to move throughout the body. When someone becomes dehydrated, the amount of water in the bloodstream decreases, making blood more concentrated. As a result, blood glucose readings may appear higher because there is less fluid available to dilute the glucose already present. Staying well hydrated helps maintain normal blood volume, allowing the body's circulatory system to function more effectively. Healthy kidney function is another major reason hydration is so important for seniors with diabetes or those at risk of developing it. The kidneys continuously filter the blood, removing waste products while regulating water, minerals, and electrolytes. When blood sugar levels rise above certain levels, the kidneys may remove some excess glucose through urine. This process depends on having enough water available. Without adequate hydration, the kidneys may have a harder time maintaining normal filtration and fluid balance. Although drinking more water does not force the body to remove excess sugar, proper hydration supports the kidneys in carrying out their natural functions as efficiently as possible. Water also contributes to healthy circulation, which is especially important for people managing diabetes. Good circulation ensures that oxygen and nutrients reach tissues throughout the body, including muscles and organs that rely on a steady supply of energy. Efficient circulation also supports the delivery of insulin, whether produced naturally by the body or administered as medication, to cells where it helps regulate blood sugar. When dehydration reduces blood volume, circulation may become less efficient, making the body work harder to maintain normal function. For seniors who are physically active, hydration becomes even more important. Exercise is often recommended as part of a diabetes management plan because it helps muscles use glucose for energy and can improve insulin sensitivity over time. During physical activity, the body loses water through sweat, even if the amount is not noticeable. Replacing these fluids helps maintain normal body temperature, supports muscle function, and allows physical activity to continue safely. Drinking water before, during, and after exercise can help reduce the risk of dehydration while supporting overall metabolic health. Water may also help reduce the temptation to choose sugary beverages. Many drinks marketed as refreshing, such as soft drinks, sweetened teas, flavored coffees, fruit punches, and energy drinks, contain significant amounts of added sugar. Regularly consuming these beverages can contribute to higher calorie intake and larger spikes in blood sugar. Choosing plain water instead provides hydration without adding sugar, carbohydrates, or unnecessary calories. For seniors who find plain water less appealing, naturally flavored water with slices of lemon, cucumber, berries, or fresh mint can provide variety without added sugars. Hydration also supports digestion and nutrient absorption. Water helps break down food during digestion, allowing nutrients to be absorbed efficiently through the digestive tract. Good digestion is important for everyone, but especially for older adults who may already experience slower digestive function. Proper hydration can also help prevent constipation, a common concern among seniors that may become more noticeable in people with diabetes due to certain medications or reduced physical activity. Another important benefit of staying hydrated is helping the body respond better during periods of illness. Infections, fever, vomiting, or diarrhea can increase fluid loss and make blood sugar more difficult to manage. During these times, dehydration can develop quickly, particularly in older adults. Drinking enough water, unless a healthcare provider has recommended fluid restrictions, helps replace lost fluids and supports the body's normal recovery processes. Monitoring hydration becomes especially important during periods of elevated blood sugar, as increased urination can further contribute to fluid loss. Some people believe that drinking excessive amounts of water will rapidly lower blood sugar, but this is a misconception. The body carefully regulates fluid balance, and drinking more water than needed does not directly remove glucose from the bloodstream or replace medical treatment. In fact, excessive water intake in a short period can be harmful for some individuals, particularly those with certain kidney, heart, or liver conditions. The goal is consistent, balanced hydration throughout the day, based on individual health needs and guidance from a healthcare provider. For many seniors, staying hydrated is not only about how much water they drink, but also about when they drink it. Spreading water intake evenly throughout the day helps the body absorb and use fluids more effectively than consuming large amounts all at once. As people age, their sense of thirst often becomes less reliable, making it important to develop a consistent drinking routine. Rather than waiting until the mouth feels dry or thirst becomes noticeable, older adults can benefit from drinking small amounts of water at regular intervals. This steady approach helps maintain hydration while supporting the body's normal daily functions. One of the best times to drink water is shortly after waking up in the morning. During sleep, the body continues to lose fluids through breathing and perspiration, even though no water is being consumed for several hours. This means many people wake up slightly dehydrated. Starting the day with a glass of water helps replace some of the fluids lost overnight and supports circulation, digestion, and normal body functions as the day begins. It can also be a simple habit that encourages consistent hydration throughout the rest of the day. Drinking water before meals is another helpful practice for many seniors. Having a glass of water about 20 to 30 minutes before eating can support healthy digestion by preparing the digestive system for food. Some people also find that drinking water before meals helps them better recognize feelings of fullness, which may support healthy portion sizes as part of an overall balanced eating plan. However, water should not be viewed as a replacement for nutritious meals, especially for older adults who need adequate calories and nutrients to maintain strength and overall health. It is also beneficial to drink water with meals, although moderation is key. Contrary to a common myth, drinking reasonable amounts of water during meals does not significantly interfere with digestion. In fact, water helps soften food, making it easier to chew and swallow, which can be especially important for seniors who have dental concerns or difficulty swallowing certain foods. Water also helps move food smoothly through the digestive tract and supports the breakdown and absorption of nutrients. Between meals is another ideal time to sip water. Instead of drinking several large glasses at once, taking a few sips every hour or so allows the body to maintain a more stable fluid balance. Many seniors find it helpful to keep a reusable water bottle or glass nearby as a reminder to drink regularly. Pairing water intake with daily activities such as reading, watching television, taking medications, or checking the time can make hydration a consistent part of the daily routine. Physical activity increases the body's need for fluids, even if the exercise is gentle. Walking, gardening, stretching, or household chores can all lead to water loss through sweat and increased breathing. Seniors should drink water before beginning physical activity to start well hydrated. During longer or more strenuous activities, taking small sips of water helps replace fluids as they are lost. After exercise, drinking additional water supports recovery and helps restore normal fluid levels. The exact amount depends on factors such as the duration of activity, weather conditions, and individual health needs. Warm weather is another time when paying attention to hydration becomes especially important. High temperatures and humidity increase fluid loss through sweating, even if a person does not feel particularly hot. Seniors are often more vulnerable to heat-related illnesses because their bodies may not regulate temperature as efficiently as they once did. Drinking water regularly before, during, and after spending time outdoors can help maintain hydration during hot conditions. Wearing lightweight clothing and seeking shade during the hottest parts of the day can also reduce the risk of excessive fluid loss. Illness can significantly increase the body's need for water. Conditions such as fever, vomiting, diarrhea, or infections often lead to additional fluid loss. Elevated blood sugar levels may also increase urination, making dehydration more likely. During these periods, drinking small amounts of water frequently can be easier than trying to consume large volumes at once. Seniors who experience prolonged illness or have difficulty keeping fluids down should seek medical advice, especially if they have diabetes or other chronic medical conditions. Many older adults wonder whether they should avoid drinking water in the evening to reduce nighttime trips to the bathroom. While it may be reasonable to reduce large amounts of fluid 1 or 2 hours before bedtime if recommended by a healthcare provider, avoiding water for the entire evening is generally not advisable. The goal is to stay well hydrated throughout the day, so there is less need to drink excessive amounts late at night. Individual needs vary, particularly for those taking medications such as diuretics or living with heart or kidney conditions, so hydration schedules may need to be adjusted based on medical guidance. One of the most common questions seniors ask is, how much water should I drink each day? The answer is not exactly the same for everyone. Hydration needs vary from person to person depending on age, body size, activity level, climate, overall health, and certain medical conditions. While many people have heard the advice to drink 8 glasses of water a day, this guideline is only a general suggestion and should not be considered a universal rule. Some older adults may need more water, while others may need less, based on their individual circumstances and the recommendations of their healthcare provider. In general, many healthy older adults benefit from drinking fluids consistently throughout the day rather than trying to reach a specific number all at once. Water should make up the largest portion of daily fluid intake because it hydrates without adding sugar, calories, or caffeine. Other beverages, such as milk or unsweetened herbal tea, can also contribute to daily fluid intake, and many fruits and vegetables naturally contain a high amount of water. Foods like cucumbers, watermelon, strawberries, oranges, tomatoes, lettuce, and celery can provide additional hydration while supplying important vitamins, minerals, and fiber. Body size plays an important role in determining fluid needs. Larger individuals generally require more water than smaller individuals because they have a greater amount of body tissue that depends on adequate hydration. Physical activity also increases fluid requirements. Seniors who walk regularly, exercise, garden, or spend time outdoors may lose more water through sweat and breathing than someone who is mostly sedentary. Replacing these lost fluids helps maintain normal body function and supports overall health. Weather conditions can significantly affect hydration needs as well. During hot or humid weather, the body cools itself by producing sweat, which increases fluid loss. Even on cooler days, dry air and wind can contribute to dehydration without a person realizing it. Seniors should pay extra attention to drinking water during heat waves, vacations in warm climates, or whenever they spend extended periods outdoors. In contrast, some people mistakenly drink less water during colder months because they feel less thirsty, even though their bodies still require adequate hydration throughout the year. Certain medical conditions may increase or decrease the amount of water an older adult should drink. People living with diabetes may lose more fluids if their blood sugar remains elevated because excess glucose can cause increased urination. This makes regular hydration especially important. On the other hand, individuals with heart failure, advanced kidney disease, or certain liver conditions may be advised by their healthcare provider to limit fluid intake. In these situations, following personalized medical advice is more important than general hydration recommendations. Medications can also influence hydration needs. Diuretics, often prescribed for high blood pressure or heart conditions, increase urine production and may lead to greater fluid loss. Some diabetes medications can have a similar effect by helping the body remove excess glucose through urine. Laxatives, certain antibiotics, and medications that cause vomiting or diarrhea may also contribute to dehydration. Seniors taking these medications should discuss their fluid needs with their healthcare provider to ensure they remain properly hydrated without exceeding recommended limits. Instead of focusing only on the number of glasses consumed each day, it is often more helpful to pay attention to signs that the body is adequately hydrated. Pale yellow urine is generally considered a sign of good hydration, although certain vitamins and medications can temporarily change urine color. Frequent feelings of dry mouth, dark-colored urine, dizziness, fatigue, headaches, or infrequent urination may suggest that more fluids are needed. These symptoms should not be ignored, particularly in older adults who are more vulnerable to dehydration. It is equally important to understand that drinking excessive amounts of water is not necessarily better. Consuming very large quantities of water in a short period can dilute the sodium levels in the blood, a condition known as hyponatremia. This can become a serious medical problem, particularly in older adults or individuals with certain health conditions. The safest approach is to drink moderate amounts of water consistently throughout the day, instead of trying to consume several large glasses at once. Creating a simple hydration routine can make it easier to meet daily fluid needs. Many seniors find success by drinking a glass of water after waking up, with each meal, after taking medications if appropriate, and between meals. Keeping a refillable water bottle nearby, setting reminders on a phone or clock, or pairing water intake with regular daily activities can help establish lasting habits. For those who find plain water unappealing, adding slices of lemon, cucumber, berries, or fresh mint can provide natural flavor without adding sugar, making it easier to enjoy regular hydration throughout the day. Many older adults understand that drinking water is important, but small hydration mistakes can reduce its benefits or even create additional health concerns. These habits are often unintentional and may develop over time because of changing routines, medications, or misconceptions about how much water the body actually needs. Learning to recognize these common mistakes can help seniors support better overall health while making hydration a consistent and safe part of their daily lives. One of the most common mistakes is waiting until thirst appears before drinking water. As people age, the body's natural thirst mechanism becomes less sensitive. This means that by the time an older adult feels thirsty, mild dehydration may have already begun. Relying only on thirst can result in drinking less water than the body requires throughout the day. Instead, creating a regular schedule for drinking water, such as having a glass with meals and sipping fluids between activities, can help maintain steady hydration even when thirst is not noticeable. Another frequent mistake is drinking a large amount of water all at once, instead of spreading fluid intake throughout the day. Some seniors may realize they have not had enough water and quickly drink several glasses within a short period. Although this may seem like an easy way to catch up, the body generally handles fluids more efficiently when they are consumed gradually. Drinking too much water at one time may also cause discomfort, increase the need for frequent urination, or be difficult for people with certain medical conditions. Small, regular sips are usually a more comfortable and practical approach. Replacing water with sugary beverages is another habit that can interfere with healthy blood sugar management. Soft drinks, sweetened iced teas, flavored coffees, fruit punches, sports drinks, and many packaged juices often contain large amounts of added sugar. While these beverages provide fluid, they may also contribute to higher calorie intake and larger increases in blood glucose levels. Water remains the best choice for everyday hydration because it contains no added sugars or calories. Unsweetened herbal teas or naturally flavored water with slices of fruit or herbs can also provide variety without significantly affecting blood sugar. Some seniors intentionally drink very little water because they worry about frequent trips to the bathroom, particularly during the night. While this concern is understandable, limiting fluids too much can increase the risk of dehydration, constipation, urinary tract infections, and other health problems. Rather than avoiding water altogether, it may be more helpful to drink most fluids earlier in the day and reduce large amounts shortly before bedtime, if advised by a healthcare provider. Finding a balanced routine allows the body to stay hydrated while minimizing sleep disruptions. Ignoring early signs of dehydration is another common mistake. Symptoms such as dry mouth, dark-colored urine, headaches, dizziness, unusual fatigue, muscle cramps, or reduced urination are sometimes dismissed as normal signs of aging. However, these symptoms may indicate that the body needs more fluids. In older adults, dehydration can sometimes lead to confusion, difficulty concentrating, or an increased risk of falls due to dizziness or weakness. Recognizing these warning signs early allows hydration to be corrected before more serious problems develop. Another misunderstanding is believing that all beverages hydrate the body equally. While many drinks contribute to fluid intake, some beverages may not be the best choice when consumed in large amounts. Drinks containing high levels of caffeine may have a mild diuretic effect in some individuals, although moderate caffeine intake is generally not associated with significant dehydration for most healthy adults. Alcoholic beverages, however, can increase fluid loss and should not be relied upon for hydration. Choosing water as the primary beverage remains the simplest and most effective strategy. Some people assume that drinking as much water as possible is always beneficial. In reality, excessive water intake can also be harmful. Drinking very large amounts within a short period may overwhelm the body's ability to maintain a proper balance of sodium and other electrolytes. This condition, known as hyponatremia, can become serious, particularly in older adults or individuals with certain medical conditions affecting the heart or kidneys. Hydration should focus on meeting the body's needs rather than greatly exceeding them. Failing to adjust water intake during special situations is another mistake many seniors make. Hot weather, physical activity, fever, vomiting, diarrhea, and periods of elevated blood sugar can all increase fluid loss. During these times, the body may require additional fluids to replace what has been lost. On the other hand, some medical conditions, such as advanced kidney disease or heart failure, may require fluid restrictions. Seniors should understand that hydration needs are not always the same every day, and may change depending on health conditions, medications, daily activities, and guidance from their healthcare provider.